So just to start off, because I want it to be kind of an open discussion, so I'm not going to spend ages on the few slides I have, but I'm sure Eileen can share them afterwards. But just in terms of involving patients and the public in plain English summaries, as you'll see on the research cycle, it kind of fits in under design and managing. So it's sort of the beginnings of your research and where you'll use your plain English summaries, and that's kind of where it sits in the research cycle. But it sort of fits in as well under undertaking it, your research and disseminating, and we'll explain a little bit more about that as we go along. So next slide, please, Eileen. And this is Kate, sorry, on the line as well, who's a PPIE representative, but she'll introduce herself, no doubt, when it comes to her part. So just to remind everybody that we did run a long session on for the junior faculty, a bite-sized session back in June 24 on what makes a good plain English summary. And this was co-presented by Lisa Edel and two of the GOSH Young Persons Advisory Group members. And there's a link there that you can actually go and listen and look at that session to get sort of more detailed information about it all. But one of the things we pulled up was just to ask people what they thought a good plain English summary would look like. And you can see, I can't remember what these are called. Do they call like Menti? There's word clouds, that's the word, word clouds. And all the words that came up, which we were pleased to see before we ran the session of what you thought a good plain English summary means to you. So just today I thought I'd just quickly refresh on some of the key points that we had in our June session, and then quickly touch on, how are patients and public involved in reviewing patient information, plain English summaries, and then just a Q&A with Kate. But we're going to have that as very informal as well, so that we can just hear from Kate, and then hopefully have some time for discussion. So next slide, please, Eileen. Thank you. So why are they important? So I think people are really realising now that it's a key part of most funding applications, I'd say nearly all funding applications, and it's a requirement by most major funding bodies to have a plain English summary. And we don't want to see it as homework for people. We want to see it as something that you enjoy doing, she says. I love helping with plain English summaries. They're really interesting to do, but a lot of people do find them quite onerous. But we want you to think of them as something that will help you in your research and help you as you develop your research as you go along. Reviewers use plain English summaries to inform their review of the overall funding application. So a lot of the time, Kate might touch on this, but my understanding is that sometimes patient and public involvement representatives will go straight to the plain English to give them an idea of what is this research about. It's the first place they'll go to. Funders can use the summary when publicising research on their website, so it enables inclusion and accessibility. So if a plain English summary isn't inclusive and accessible, then it's not a good thing. We want researchers to see plain English summaries as a foundation for them to build and adapt their research. Been working with somebody from the junior faculty recently, and we've literally redone his plain English summary 2 or 3 times. Every time we've gone back, we thought, oh, that could be written a little bit clearer. Oh, this is the stage I'm at with the research now. Let me adapt this. So we want to see it as something that you can grow and evolve, and to help support you in your engagement as well with patients and the public. In terms of key messaging, there's so much information out there. There's information on the hub. There's information on the online recording. But basically, the key messaging around plain English summaries is that writing easy to read sentences does not always mean information is conveyed effectively. So we say just because sometimes people think, well, I'll make it a lot easier to read, it doesn't mean that you're conveying the information effectively. So just be careful that you don't fall into these sort of pitfalls in a sense. It's really important to simplify complex terminology. So if you use everyday analogies or plain English explanations, it doesn't mean that you take away from what you're saying. It just means that you then reach out to the public and patients and say, look, I've said it this way, but this means this, using examples. And you've got to sort of think of it as somebody in your family or friendship group that has got nothing to do with science, medicine, research. Completely take yourself out of that environment and think, how would they understand it? Or yourselves, so an area that you might not have any sort of background in, how would you feel if something was really not explained to you properly and clearly? Because straight away what you're doing is you're putting up a wall between yourselves and the patients and the public, and eventually the patients who'll be involved in your research. So there's a wall there already if your plain English summary isn't clear. So you've already put this barrier up between you and them. It's really important not to change the meaning of what you want to say, but you may need to change the way you say it. So you want to hold on to the meaning and what it is that your research is about, essentially, but you may need to change how you're approaching it. And there's lots of examples on the hub as well, on the BRC website. Some good exemplars of how people have written summaries, just to give you some ideas. Next slide, please, Eileen. So involving patients and the public in your patient, keep saying patient information sheet, your plain English summary, it could be that they're going to help you shape your patient and your plain English summary. So it could be that you're meeting with patients and the public, first of all, to engage with them about your research, talking to them about what it is you're doing. You're already then giving them some information and background about what it is you want to do, what it is you want to achieve, etc. You can pick up from people from even that conversation as to whether they're understanding what you're saying, or there's questions that can all be used for developing your plain English summary. You're explaining the background to why it's important and their function in helping you. I have some guidance I can send out to people on how to review a plain English summary that we use when we're having PPIE panel members for the BRC funding calls. And we found with, I know there was one plain English summary I worked on with a researcher where we did a lot of sending out, people reviewed it, they returned it, repeat. So it doesn't mean it's a one-off thing. It should be a sort of a timeline for you. And when we speak about timelines, always think about these things take longer than you think. PPIE will always take longer than you think. This is what I always say, plan, get ahead of yourselves. So if you're sending it out, you're expecting time for it to be reviewed, time for you to look at the you said, I did, send it back out again, repeat. So it could take 2 or 3 times to just get it right. And the more people you have involved as well, you have differences of opinion. You've got to kind of consolidate that. Formal reviewing, which is what we're going to get on to now with Kate, is people who then join PPIE panels, as I mentioned, on funding calls, for example, the Catalyst Fellowship or the New Projects call. And their role is to formally review, not just the plain English summary, but the actual research plans, and have patients and the public been involved in setting up the research or getting involved in the early stages? You know, is there a budget set for PPIE, etc.? So that's kind of the formal reviewing part of it, where somebody leaves the shaping part and steps over and formally reviews, or as an NIHR PPIE funding panel member. So any of the research that you're applying to get funding for will no doubt have a PPIE panel as part of the funding body that will sit and look at your work and review it. So I can move on quickly to Kate's questions now, Eileen, if that's all right. Hello, Kate. Nice to see you.
Hello. Can you guys hear me okay?
Yeah, that's great. Thank you.
Great.
So just, Kate, just to get your, because this will be a real learning, I know I've had a chat with you in the past about your background, etc., but just to kick off, like, what was your pathway to getting involved in PPIE and research, like not just at GOSH, but the NIHR? Could you just tell us a little bit about your motivation?
Yeah, no, absolutely. So first of all, thanks so much for having me. So my name is Kate Hawley. I'm based up in Newcastle upon Tyne, but I'm afraid I'm joining you today from the wonder of a service station. I work for the Forestry Commission in my real life, so I'm not a medical professional. I'm a senior civil servant, and I've been out on site having a wonderful time in the woods this morning. So I'm just in a cluster. So I'm hoping you can hear me okay.
Oh wow.
Yeah, I suppose you're wondering, gosh, how on earth did you find your way into PPI? And the answer is I had quite a what turned out to be quite a high-risk pregnancy in 2018 and a very difficult delivery. And I found myself on maternity leave and realized, I was like, gosh, what have I done with my life with my little tiny baby? And realized during that year that there was the opportunity for me to be involved in sharing my patient experience as a member of maternity services to ultimately try and improve maternity services. And I discovered this, what we call the Maternity Voice Partnership, which is a NHS England initiative. And ultimately, it's a service user-led group of recent service users of maternity services. And long story short, I ended up leading that organization through COVID, actually. So sort of from about 2019 to 2021, which of course was a very, very difficult time to give birth at all, with all of the issues with COVID. And I just found, I went back to my day job in the Forestry Commission after I had my children, but I just found myself really enjoying the opportunity to get involved in sharing my patient voice, which for a long time was just in that maternity space, but actually then spiraled horrendously because I just couldn't say no when people asked me to be involved in other things. And anyway, long story short, I was reached out to by the NIHR, and they said, would you like to join our academy, which is the organization that does the Senior Investigators Award, all the doctoral fellowships, the academic fellowships, the advanced fellowships, all of that. They were like, would you like to sit on our interview panel for those, where you assess funding applications for us? And I didn't really know what I was getting myself into. I was like, absolutely, that sounds really fun. I'd love to do that. That was 2022. So I've now done that 3 years, and that's also spiraled. I do the same thing now for Cancer Research UK, British Heart Foundation, and I also do it for both the funding bodies in Wales and Scotland. So yeah, it's very much what I spend my spare time doing now when I'm not dealing with red squirrel and badger issues anymore.
And being a mum, so
yes, that too. Yeah.
So I think this is a really good example of somebody who's really, really involved, but has so much else going on outside of it. And that's just something to keep in mind when we think about involving patients and the public in supporting us. We're very aware that all of our PPIE panel members have got a complete other life going on there. I had no idea that you were out and about today off site. And so thank you, Kate, for starters, for joining us from Costa Coffee in a service station. That just shows commitment. But it's just that awareness that you need to have, I think, around, as I said, the timelines for getting people involved and just being really aware. We sit at work and we're on our email all day, and we're not realizing sometimes that people are actually out there doing lots of other things, and when we get them involved, we've got to be really mindful of that. But also, it's really, really helpful, not that we want to ask you about the inner workings of the NIHR. It's a bit like you're a spy for us in the NIHR, but it's really helpful that you've got such experience on that side as well. So there might be a few questions for you around that. But yeah, the lived experience coming through and people really wanting to help and support research is why we have such wonderful PPIE panel members here at the BRC as well. But what do you think is important, do you think, and beneficial then for when you're involved in reviewing funding call applications and plain English summaries? What do you think is the most important and beneficial things for panels to be involved in?
Yeah, well, so one of the big learning points I've had in being involved in healthcare research is how complicated it all is. And I speak from a place of privilege, and I realize that in the sense that I'm a native English speaker, and I also went to university and I did geophysics at university. So it's not health research, but it is an academic scientific subject. So I do think that I'm often sort of ahead of the game, and perhaps I'm not an accurate reflection of the average British person. And yet I still sit there racking my head and often Googling on the side when I'm speaking with healthcare professionals or health research, because I think when you're involved in it as a healthcare professional or as a research leader, you just forget the words that you use that are just totally not understandable to us. So one that always bugs me, that comes up all the time in plain English summaries, and is intervention. People always talk about intervention, and for so long I was like, well, an intervention is what I do if one of my friends had a drinking problem and I wanted to sit them down, and sort of tell them, and they'd just be like, we want to develop this intervention, and I'm just thinking, it's just not a plain English word. So just one example, but I think that's why it's so important to have the general public involved, because ultimately you need to make sure that your research is accessible and inclusive, and often the only people that can really tell you that is the people that will be benefiting and the general public. And if it's not understandable to us, then I'm afraid we can't intentionally and meaningfully help you. A lot of people spend a lot of money on PPI. £25 an hour often is what you're paying, and there's no point in spending that money if you've got people there who are Googling on the side who don't quite understand what you're saying. So that accessibility is really, really key, and now is like my MO. I spend so much of my time looking through things and just being like, this is not plain English, this is not, I know it sounds like it's plain English, but it's not. You know, you need to, I always say, and apologies, I'm probably jumping ahead of myself, but I always say, imagine you're presenting to a primary school assembly, right? That's the level that you need to be at. Short and punchy sentences and making it really interesting. You know, imagine you've got a precocious 10-year-old sitting in front of you. How would you explain the research to them? Because ultimately, and very often, it's how you would also explain it to a 40-year-old who's also not quite sure about it. So that's like the level. I think people pitch above because that they don't want to be offensive or they don't want to come across patronizing, but actually it's the opposite. That by pitching too high, people just get really frustrated or switch off.
So you've kind of got to sit on your own shoulder and go, yeah, I can understand this, but what might be the potential words that somebody wouldn't understand? So something like intervention is a really good example, because we just think of it as, well, we know what intervention is, or
right,
different jargon, etc. And I know what you mean about the thing with our reviewers as well, is that we kind of need people like Kate who can understand what other people might not understand, in a sense, and be able to point us and say, right, okay, this is the area that if somebody was reading it that doesn't have a background in science or medicine, this is where they would struggle. And as you say, even and telling a story, I think some of the best plain English summaries I've read, you really can feel that the researcher wants to tell a story from the beginning, and they're reaching out from behind this plain English summary to the reader, and it's written in a way that's sort of friendly, if that's,
And also realizing that you need to set the context even wider than you might have realized, because it's all well and good sort of talking about the research in this sort of neat little package, but often you need to, like you say, have that narrative, you said that story of why it's appropriate to talk about. Why are you doing this? Like, what does it sit in? Like, step back and look at the research sort of holistically and be like, this is where it fits in your life, that, you know, this is why it's relevant, this is why we want to talk to you. And also finally, you know, you're talking there about the importance of, you know, having people like myself and others say, this isn't understandable, you need to change this. But you also need to realize that in order for somebody like me to have the confidence to even say that to you, it is quite difficult sometimes. So you also need to be really careful of the atmosphere that you're setting, you know, that it's a safe place, that I could say, I'm so sorry, but you lost me 10 minutes ago. Could you possibly go back? Because there's a confidence that comes with that a lot of people don't have. And actually, I think Gosh are great at this and have never made me feel like I can't say that. But there are other organizations that maybe I shouldn't say, but there are others that I've sat on committees for them. And sometimes I feel almost teary because I'm so frustrated that I don't understand what's going on. And I feel like the conversation has gone so far now that I'm just incredibly embarrassed to say, actually, I'm so sorry, but I'm not quite sure what you're talking about, you know, and so it's so it's also creating that safe environment for somebody to do that.
Yeah, that's interesting, Kate, because just in that further back slide where I mentioned about engagement, I just think that the first thing people should do is just engage with people around the research, just have a chat about it and pick up if somebody is understanding what you're saying. This is if you can manage to get hold of people to actually review, you know, work with you, say online, and, you know, if you set up a small discussion group or something, just to start with explaining the research and saying to people, we do this in Gosh, the Young Person's Advisory Group, a lot. We'll say to researchers when you come along, pitch it, off you go. And now we're just going to say, right, what part of this doesn't people not understand? And let's just stop there and try and help you. And that's the engagement part that will feed into the reviewing. But yeah, definitely, you know, the saying that we hear all the time, no research about me without me, and all of that. And there shouldn't be a them and us, there shouldn't be this divide. You know, you're working towards a common goal, really. And in a way, your role, Kate, I see it as very much like a translator, in a sense, that you're helping people translate, but also helping people to train people to then be able to translate for themselves. That they're not, and we get this a lot. People will send a plain English summary and say, you know, over to you, you know, and it's like, no, you need to start learning how you will adapt and learn and change and bring this forward with you. So the lessons you're learning from the not using the intervention, for example, that you're not going to bring it into the next plain English summary. We've kind of covered this, but have you got anything that would stand out as a good, you've got a memory like of a good plain English summary, or what that would look like to you?
Yeah, so absolutely. So I suppose the first thing I'll say about this is just that when you are submitting an application that's being scored by someone from a PPI background, very often the only part of the application that they will see will be your plain English summary and then your PPI section, which explains sort of what your plans are for public involvement. That is the only part, right? So even if the rest of your application is spectacular, I won't be reading that. This is all I'll be reading. So, you know, it is really important to spend time on this and make sure that it's right, because I've also had some really poor plain English summaries that have come through with a relatively good PPI section, and I've had to score them down because the plain English summary is just as important as the kind of those long-term PPI plans. So for like, I'm sure you're all here, so I'm sure that you all realize the importance of the plain English summary. But what I will say about this, I'm sure you know this already, so apologies if I'm saying stuff that just seems like common sense, but the format of the summary is just as important as the language that you use. All right, so I mark down significantly if it is just blocks of text, because also from an inclusivity perspective, for people with dyslexia, for example, and others, it's just much easier to understand if you have subheadings and if you use bullet points. So that like should just be a minimum for your plain English summary, that you need to have subheadings, and often those can be narrative. Deirdre, like you were saying, you know, what is my research about? What will I be doing? Why is this a problem? How will I tell people about it? You know, there's nothing wrong with using that quite colloquial language. It doesn't have to be formal, like methodology, dissemination, like none of that. It should be, what is this section going to tell me about? What is this section going to tell me about? And really short sentences too, if you can. Again, think of that punchy primary school assembly style, you know, about 10 words per sentence. It seems really short, but it just comes across better. And especially people with ADHD and, like I say, dyslexia and others, people are just more likely to take it on. If you've got a list of any kind, we're looking into this, 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 and this, or we'd like to find this, 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 and this, put it in bullet points. Don't just put it in a long sentence. It doesn't use up your word count, and it's just easier on the eye. So that's the first thing, is think about the formatting as much as anything. Second of all, and I'm sure you probably have internal policies about this, and I don't in any way mean to stand on them, but don't be afraid to use, I'm scared of saying ChatGPT, but some kind of artificial intelligence as a starting point, as a sense check, just to say, how understandable is this? Like, I'm not saying that you should get it to write it all and that's what you should use. That's not what I'm saying. But I don't think there's anything wrong with using something like that just to sense check and be like, does this sound understandable to you? And then build off that. Now, you may have internal policies on that, so I'm sorry if that goes against it. But I found that to be quite helpful when I've been looking at things in the past. So if you are looking for that, don't be afraid, I suppose, to use that as an early tool. And then finally, well, I suppose I've already said this. I think that storytelling is helpful. So, you know, bring us in with the first sentence, maybe a rhetorical question. Have you ever found that you haven't been able to do this? This is what we hope to do. Or, you know, so kind of start it off strong, and then, like I say, have those subheadings that take me through, so that at the end I'm like, oh yeah, that's actually really simple. So yeah, that would be my thoughts.
And not to underestimate the struggle, because it is really, really hard. We understand, with some really complex medical terminology or scientific backgrounds, it is really, really difficult. And there is a point sometimes where there is very little you can do to kind of translate that. But if you've at least made some inroads to just give some backup, at the beginning, and then say, you know, or sometimes what we say as well, to pronounce, so like Hirschsprung, you know, I actually looked that up to how could that be pronounced, so that the reader isn't going, I don't know how to say this word. So even if it's spelt out a little bit like that, it kind of, you're showing a willingness to break down that barrier, do you think, Kate, between?
Absolutely, yes. And the other thing I've just thought is, don't really think about the level of detail that you need to go into in the plain English summary. Obviously, you need to ultimately, the reader needs to come away understanding what your research is about and what your ultimate goals are, what the problem is that you're trying to address. But you don't necessarily have to go into like minutiae detail. Like, I remember there's been several plain English summaries I've used where they felt a need to name like the different drugs that they were testing. And I've often thought to myself, you know, do you need to name all 4 of these drugs because they're long and, you know, difficult, intimidating words? You could just say, we will test 4 different drugs to do this. You know, like, as a plain English individual, as a lay individual, I don't think I need to know that level. Now, ultimately, that's something that you could discuss, I suppose, with your advisor or with other members of your research team to make sure you've got that level of detail. But sometimes I've seen them fall down that hole where people have felt like they almost need the same level of detail that they have in their academic summary, but just said in plain language. Whereas actually, I would argue that sometimes you'd need to take a bit of a step back and just, like I say, tell the story of what you're trying to do. But it's okay to say things like, we will test these number of drugs, or we will try a new method for this, rather than being like, and that method will include doing this with this specific bone and that with this specific bone. Like, sometimes I don't think that's needed to understand what the research is ultimately trying to address, so there's a balance there as well.
And you're freeing up some word count as well if you don't do that, because obviously word count, it's very difficult, because what you're trying to do is be really succinct, be really engaging, explain something in plain English and get across what it is you want to do, and sometimes quite a short word count. I don't know if you've got any. I think we've done quite a lot of takeaways. If there's one thing, what would you say would really sort of make you think, right, okay, this is a really good takeaway for the junior faculty?
I think that the key takeaway is the formatting. Like, that is the start. So do not, under any circumstances, submit a plain English summary that doesn't have any subheadings. Like, that is just, in my mind, a total own goal from step one. And it doesn't take that much. It is not that difficult just to put some subheadings. So and it shows you've made an effort.
It shows you've made an effort as well. And obviously visually, the first thing you see, like if I had this 1, 2, 3, 4, and it was just blocky, whatever, you put off straight away. So your initial then reaction is, this person doesn't care, or I'm going to have to work really hard to even engage with these words. So straight off, you're like probably annoyed, thinking, oh great, now I've got to do all the work here to meet this person halfway. And I think that's why, if you do have people that are going to help support you to produce or work with you to co-develop your plain English summaries, if you can meet them, I would say, if you had time to just sit down and engage with them around the research and build up that relationship to begin with, that's really, really helpful. Obviously not always possible, but yeah.
And sometimes a good way to do that is, I was once asked by I was once asked by a PPI group. They said, Kate, can you describe our research to us? And I was like, oh my gosh, I don't think I can, and so there I was being like, well, you're doing this thing with genes and gene therapy, but then I couldn't quite remember exactly what gene therapy meant. So then I had to kind of explain it. And it was really interesting, because I found myself using words that I knew that I would use with a friend, and they found that to be a really helpful experience, even though I was mortifyingly embarrassed. So like, I think that there's something there. If you have individuals you trust that are lay, ask them, say to them, look, I've spoken to you about my research. Can you tell me in your own words what you think it is, and see how they describe it, because that can really help.
And work together on it, sort of, then it's kind of a co-developed sort of piece of work as well. I think we've probably gone over. I've got no idea what time it is. We don't want to run over. Sorry, Eileen.
I am sorry, just really quickly, I see that Eileen has put in the chat that there's a readability tool, and again, don't hesitate to use that. I actually used to use it when I was scoring a lot, as in it would be the first thing I would do is I would put it through a readability tool. Just so you know, there has been some changes made in NIHR and other funding bodies where I'm not allowed to do that anymore, just in terms of like privacy and things. So I actually don't do that anymore, but that's not to say that that's not a really helpful tool. And you do need to be aiming for a reading age of about kind of 10 to 11. And finally, I don't know if you guys have children yourselves, but I certainly find that my 7-year-old is really good now at helping me with this. If you have a precocious child, get them involved. They will not hesitate to tell you what they think.
Yeah, friends and family, as you said, friends and family from that have not got a scientific background.
Yes, exactly. Yeah.
So we'll finish up there, Eileen. If I don't know if anybody's got any questions or time.
Thank you both so much. That was so interesting. And yeah, thank you, Kate, especially. That's just so good to hear from your perspective. And yeah, I was going to ask about AI, actually. I think we can't shy away from it. It's happening. And I think it's just interesting to hear how you can use it wisely. And I think could be a very helpful tool.
It's one of the things that we often say in our scoring meetings, is we say, gosh, it would have taken this individual 10 seconds to run this through ChatGPT, and ChatGPT would have told them immediately that it wasn't understandable. So So yeah, definitely a tool that if you're allowed to use it, then I would recommend it.
Yeah, we just don't want it to sound AI. That's the thing.
I guess that was going to be my question.
Yeah, I think that's really, really important. It's all very well to use it, but it's so obvious when somebody's just lifted it. And actually, as a lay reviewer, that would irritate me even more if somebody had just put it through AI and I just thought, well, that's done the job for me, and that's the end of it.
Yes, and you can always tell because of the use of the Oxford comma. So that's how I always spot AI in English summaries, is that they always use Oxford commas, and they often use dashes more than perhaps we would normally. But yeah, so agree. Yeah, that there's ways to use that, aren't there? That's appropriate.
Yeah, I was looking at educating. I think it's called Educating Yorkshire, and the school. It was quite interesting because a friend of mine said just have a look at it. There was the child on it the young person on it last night who was doing Shakespeare. She was dyslexic, and she'd obviously used AI, but she's incredibly good at saying she hadn't. The teacher brought her in. There was a whole meeting and hoo-ha about it, and it was so obvious. The teachers were looking at the work, going, it's very well written, but we know it's not. We know it's got that AI feel to it. It was just a little bit too good. But she denied it. But I'd say, don't deny it, but use it. But then, still go in and interrogate it and try and get your own writing style. It's a bit like looking for your own writing style, I think, with Plain English Summaries. We all had our own writing style at school, and it's kind of important that you come back to that voice. And as Kate said, even things like, did you know that children have this, did you see you're reaching out and you're making it more accessible, even those simple little ways that are quite subtle, but yeah. Thank you so much, Kate.